The number one barrier in the healthcare system that hinders for immigrant and refugee families is the lack of certifying interpreters.
Not all translators are aware or capable of translating everything. If he doesn't have vocabularies or medical vocabularies, he cannot make medical translation.
Africans, we suffer from an American bias that we don't have uniting languages.
Mm-hmm.
So it's almost as though they dismiss us and say, well, there's no African language you could learn. Like
Yeah.
you could speak to people from 2 different African countries. You know?
Yeah.
A lot of people speak Swahili, a lot of people speak French,
Like me
a lot
and
of
you.
people also speak English. And a lot of people across borders speak certain languages. And so if you had translators to sort of meet people where they're at.
On the other hand, the interpreter himself is from another Arab country. As Omar said, the western parts of the Arab world, their dialects are very different from ours. The Tunisian, for example, interpreter wouldn't understand the same words that we use in our culture or the same ways that we deal with in our culture. So that was another problem.
Like for myself, when I got to the United States and going to the doctor, I came from a completely different system. If I went to a government hospital and they couldn't figure out what was wrong with me, or if I went and I was given medicine, I paid for the medicine. I didn't pay for consultation. I didn't know there was something separate that was called consultation.
Yeah.
And so a couple of years ago, I was very ill and kept going to the doctors, and they couldn't figure out what was wrong with me. But then the consultation fee, it just kept ballooning and going until I ran out of money, you know.
Iraq and the United States, his eyeglasses, actually they cost him more than $200 here in America. So finally his daughter sent him that eyeglasses from Iraq for only $25. So this kind of difference in the system and the cost is creating more confusion, let's say.
We hope that you've enjoyed listening to the discussion here, but more importantly that the conversations continue in your communities, and also if you're a physician or a practitioner or a community health worker, that you bring this dialogue back and share it amongst your peers so that you can help us become partners in having a healthier Oregon. Thank you.